list by the end of the year. And we can speak now to Chief Executive Niall Dickson. Morning to you from NHS Confederation. Thanks very much for joining us. How do you get these figures? They seem, they are alarming at first if you first look at them.
Yes, well, there's been independent work done by the Nuffield Trust and also by the Independent Providers Health Network. And I think the indications are, first of all, that we went into the pandemic with well over 4 million people waiting. Through the last 3 months, we're thinking we're adding on, and again, these are obviously estimates because people are not being seen and not being treated. But it looks like by autumn time we'll have perhaps 8.6 million, quite a significant number waiting, and then by the end of the year it may be as high as 10 million. Now, some of that, of course, could be affected. It depends on the rate at which the NHS can pick up. It also depends on the government renewing its deal with the private sector, which we very much urge them to do. We frankly need all the capacity we can get. And I suppose our message is a slightly wider one, that we do absolutely need to start tackling what is a mammoth waiting list problem. But we've also got other services, for example, services in the community and primary care and, of course, social care we've heard a lot of, that are under enormous amounts of strain. And the ability to build things back up again is severely constrained by the fact that we're also treating COVID patients. So we've got institutions that are divided between COVID and non-COVID. We've got staff who are wearing PPE, and we've got capacity constraints because of the social distancing that everybody will be aware of. So the message has to be to politicians, I think, that please lower expectations, don't raise them. It's great that people are recognising what health and care staff have done during this pandemic, but we need to have realism about how quickly we can build these services back up again, and as I say, not just in hospitals but throughout the whole health and care system.
I'm interested if you were able to hear, you may not have been, our interview with the Government Minister just a few moments ago, saying that the aim is not to reach projections because we're heavily funding the NHS. What's your reaction to that?
Well, no, we absolutely have to use all the capacity we can get. I'm not sure if the Minister was referring to the independent sector. I know that there have been talks going on to try and renew or extend the deal, and I very much hope that they will do that. We need to use all the capacity that we can get, and it's great that, of course, not all of it's been used because we didn't reach the levels that we expected to, or we thought in a worst case scenario we might reach during the pandemic. But going forward, we need to absolutely use the independent sector, the voluntary sector, where they have capacity as well. We need to use all the capacity we can possibly get going forward. We've got a significant number of staff who are pretty exhausted and traumatised, having gone through this process. We've got trying to build up these services while we're running these traditional COVID services, if I can put it that way. And we absolutely need to mobilise the independent sector, the community and voluntary sector, and to work much more closely, frankly, with local government and social care than has been possible in the past.
He said that they shouldn't have to rely on the private sector. Just also another important question as well, I suppose, is, if you have all these people going onto a waiting list, presumably they're on the waiting list for a reason. Are you concerned about the long-term impact on health?
Yes, and we talk about things like routine operations as if this was something okay-ish. It isn't, of course, for those individuals. There are two aspects to this. One is quite often they may be in significant discomfort or even pain in waiting for the procedure to happen. And secondly, of course, in some cases, their health will deteriorate the longer that the wait that they have. Now, we're nowhere near back to where we were in the 1990s in terms of the number of people waiting or the length of time they're waiting. The NHS has made fantastic progress. But the reality is, before we went into this pandemic, we were already facing a crisis where waiting lists were building up. And this is and the NHS is so much more efficient, if you like, able to treat many, many more patients than it used to treat. But the reality is the demand has increased, the changes in the way our society operates and the operations that are able to be done, and the people who are surviving, thankfully, who did not survive before, means that there is huge pressure. Now, that pressure is going to reappear big time as soon as this pandemic recedes, as we all, of course, hope it will. And what we're making a plea for, one is government, you need to look at funding, you need to look at the independent sector, you need to look at regulation, and you need to look at freeing up at local level people to find their own solutions to some of these problems. But we're also asking them to raise not to raise expectations, not to say this will all be solved. We need to have a grown-up conversation with the public about what the health service and indeed social care can do over the months and years ahead, because it will be restricted and we will be desperately trying to make good some of the damage that has been done over the months of the pandemic.
Niall Dickson, Chief Executive from NHS Confederation, I appreciate your time. Thank you.